Arizona. He is also the editor of many international impact factor journals. So,
thank you very much, organizer, for organizing this excellent event. हमने अब स्टेम सेल्स का माशाल्लाह काफ़ी सुबह से सुन लिया है, तो आई एम चेंजिंग द टॉपिक. Preclinical and clinical studies indicate that stem cells are very promising. Stem cells have the potential to treat large number of diseases that cannot be cured conventionally, that cannot be cured with conventional medicine. However, sometimes stem cell therapies may fail. Stem cell therapies are not successful. Or the outcomes of stem cell therapy may be different in different patients or in different centers. For example, a patient goes to some clinic, stem cell facility, he gets some stem cell treatment, but he is not satisfied. Then he can go to some other clinical facility and now his condition is improved. So it means that there are large number of factors. जो एक स्टेम सेल लैब है उसमें प्रोसेसिंग डिफरेंट हो सकती है, वो डिफरेंट स्टेम सेल टाइप्स को यूज़ कर सकते हैं, उनकी एक्सपर्टीज़ डिफरेंट हो सकती हैं. सो इन दिस प्रेजेंटेशन आई विल डिस्कस सम ऑफ द फैक्टर्स that can influence outcomes of stem cell therapy. So stem cell therapy is a form of regenerative medicine that is designed for three things. Basically to repair the damaged organs and tissues, to replace the lost organs and tissues, and most importantly, to maintain the healthy organs and tissues. Stem cell therapy works by different mechanisms, by homing to damaged tissues and organs, and by differentiating into other types of cells, and also by paracrine actions, in which stem cells release different types of growth factors, different types of cytokines, exosomes, that signal the resident stem cells to differentiate into specific cells, required cells, and also these cells have immunomodulatory functions. So all these mechanisms indicate that stem cell therapy is a viable treatment option for large number of diseases. Now, अगर हम stem cells की बात करें, तो results of thousands of clinical, preclinical studies have already been published. Thousands of clinical trials have already been completed, but still, and the results of all of these studies are very promising. But still, stem cell therapy may fail in certain patients. And if we consider both of these points, ये success को देखें और failure को देखें, तो I personally believe that currently the question is not if stem cell therapies have therapeutic potential or not. इनका potential तो है. However, the question is how we use stem cell for therapeutic purpose. And you know, the science is designed to tell us what is possible and what we can do. The science is not designed to tell us what is right, what is wrong, and what we should do. So before discussion of these important factors, I would like कि हम ये वाली slide देखते हैं. In conventional medicine, हमारी क्या expectations होती है? In conventional medicine, we use different drugs, we use different chemicals, और हमारी उसमें क्या expectations होती हैं? एक अच्छी processing facility होनी चाहिए, अच्छे फार्मासिस्ट होने चाहिए जो अच्छी तरह से उसको प्रोसेस कर सकें, मेडिसिन को बना सकें, उसकी क्वालिटी, क्वांटिटी, प्रोसेसिंग, ऑप्टिमम स्टोरेज कंडीशंस और उसकी जो डोसेज हैं वो डिफाइंड होनी चाहिए. बट व्हाट अबाउट रीजनरेटिव मेडिसिन? In regenerative medicine, we use stem cells which are more sensitive, ये living cells हैं, more sensitive हैं, तो हमें इसमें भी इन सारी चीज़ों का ख्याल रखना है, बल्कि ज़्यादा ख्याल रखना है। इनकी प्रोसेसिंग बेहतर तरह से हो, वायबिलिटी मेंटेन की जाए, इनका नंबर जो है वो ऑप्टिमाइज्ड होना चाहिए। So these are few major factors that can affect the outcomes of stem cell therapy. तो हम इनको briefly discuss करते हैं। Enrollment of patient. This is the first very important step for stem cell therapy, for the success of stem cell therapy. So theoretically, all the diseases in which there is a tissue degeneration, they can be treated with stem cells, with stem cell therapy. But still, all the patients are not eligible for stem cell therapy. The reason is that it will depend on the patient. अगर आप hair regeneration में stem cells काम करते हैं, but if there are not hair follicles, हम stem cells लगाते जाएं, नहीं फ़ायदा होगा. Similarly, if a patient has some other diseases, genetic diseases, due to some mutations or due to some deletions, तो उसमें stem cells क्या करेंगे? The stem cells can replace these mutated cells. Mutated cells ने mutated cells को replace कर दिया है. So stem cells ने उसमें DNA की repair नहीं करनी, उस deletion को clear नहीं करना. These stem cell therapy can replace these mutated cells. लेकिन अगर हम autologous cells को इस condition में autologous cells को use करेंगे, तो क्या होगा? Mutated cells को replace कर देंगे. So in these conditions, we can use other strategies. For example, we can use stem cells from other non-mutated tissues, or we can combine gene therapy with the stem cell therapy, or we can select other allogenic sources which have low immunogenicity. जैसे हम पहले बात कर रहे हैं cord tissue के stem cells को use कर सकते हैं. So हमें define करना है patient to patient उसकी selection के लिए कि what is better. So it is very important to evaluate the condition of patient for stem cell therapy to consider if she is eligible for stem cell therapy or not. और उसके लिए information कहाँ से आएगी? Literature है, preclinical studies हैं, publications हैं, clinical trials हैं, and experts हैं fields में हमारे colleagues हैं, उनके साथ discuss किया जा सकता है. So to consider if a patient is eligible for stem cell therapy or not, these are few points that can be considered. Patient's general health, medical condition, type and stage of the disease, treatment history, and availability of suitable donor, or the ability to use patient's own stem cells. And most importantly, the likelihood that the disease will respond to stem cell therapy or not. जैसे मैंने पहले बात की है कि अगर स्टेम सेल्स ने वहाँ पर काम ही नहीं करना, तो फिर इसको हम एक सेशन की बजाय 10 भी लगा लेंगे, तो फिर उस पेशेंट को फ़ायदा नहीं होगा. So after selection of the patient, the second most important step is the selection of suitable stem cell source. The success of stem cell therapy depends on the selection of stem cell source, and the reason is that all stem cell sources are not equivalent. एक disease है, हम उसमें सारे हर तरह के stem cells को use नहीं कर सकते, because all stem cell sources are not equivalent in terms of their regenerative potential, because biological properties of stem cells depends on the sources from which they are isolated. So selection of sources of stem cells, हमें patient की condition को देखते हुए ही उसको select करना है कि what is important. जो disease की origin है वो क्या है, mesenchyme है, कौन सी है, कौन से cells उसमें लगाने होंगे. क्या वहाँ पर angiogenesis चाहिए तो हमें endothelial progenitor cells चाहिए. So broadly speaking, there are 3 types of stem cells: embryonic stem cells, neonatal stem cells, adult stem cells. Embryonic stem cells are isolated from inner cell mass of a developing embryo But these cells are actually the best cells in terms of their repair potential. But due to controversies, due to ethical concerns, scientific concerns, these stem cells are controversial and they are not used. Their use is very limited. Similarly, neonatal stem cells are isolated from birth-related tissues. और birth-related tissues कौन सी हैं? Cord blood है, cord tissue है, उसमें से isolate कर सकते हैं. These cells are available for autologous use only if cryopreserved at the time of birth. लेकिन अगर इनको उस वक्त नहीं करते, then they can be used allogenically. इनकी immunogenicity निस्बतन कम होती है. And adult stem cells are the most commonly used stem cells for stem cell based therapy. Bone marrow and adipose tissue. अगर हम इन दोनों sources को compare करें तो although controversies exist, कुछ कहते हैं bone marrow stem cells are better for some conditions and adipose stem cells are better for other conditions, but adipose tissue has the advantage in harvesting, isolation, expansion, and most importantly, the number of regenerative cells in adipose tissue. Adipose tissue has 500 folds more regenerative cells than bone marrow. Previously, we and others have published several papers in international journals indicating that the biological properties of stem cells derived from various sources have a great impact on their characteristics. For example, this paper, this is another paper, and this paper. For example, this paper, the results of this paper shows that if we compare the cord tissue derived stem cells and adipose tissue derived stem cells, then the proliferative potential of cord tissue stem cells is higher as compared to adipose tissue derived stem cells. While the adipogenic potential and osteogenic potential is higher in adipose tissue, the chondrogenic potential and neurogenic potential is although equivalent in cord tissue derived and adipose tissue derived stem cells. So हमें कंडीशन को देखना है कि कौन सी डिजीज़ कौन सी है और उसके अकॉर्डिंगली ही स्टेम सेल के सोर्स को देखेंगे. So the strengths and weaknesses of each type of stem cells can be identified to determine the maximum therapeutic effect of stem cells, and in this way we can design disease-targeted stem cells for each therapy. Next, outcomes of stem cell therapy are also dependent on the cell fraction used. Interestingly, जो most commonly used adult stem cell sources हैं जैसे bone marrow और adipose tissue है, they are used in different forms. For example, bone marrow is used as bone marrow aspirate, bone marrow concentrate, and bone marrow MSCs. Now, in all of these forms, in all of these fractions, the number of stem cells, the number of regenerative cells are different. Bone marrow aspirate में, for example, there are less than 1% mitochondrial stem cells. अब इसको अगर further process करें, further centrifuge करें, the number of regenerative cell will be increased. Or similarly, these are the pure population of MSCs. तो ये कीजिए शायद वो बैटरी का आ रहा है. Similarly, adipose tissue is used as macrofat, microfat, nanofat, SPF, ASEs, and also adipose tissue derived exosomes. So, ये वाली जो fractions हैं, ये plastic surgeon, dermatologist commonly use कर रहे हैं for different conditions. Dr. Mustahsan ये वाली fractions जो है इनको discuss करेंगे. No, these, for example, SPF and adipose derived stem cells, they have different concentration of stem cells, different concentrations of regenerative cells. अगर हम इनको कंपेयर करें तो as you know SVF is a mixture of various type of cells, but the regenerative cells in SVF are about 10%, 2 to 5%. So अगर आप SVF use कर रहे हैं या ASE use कर रहे हैं तो then there may be differences in the outcomes of the stem cell therapy. But it will again depend on the condition. No, effective number of stem cells is very important. Safe but effective dose of stem cells is required for each therapy. अगर एक किडनी में ट्रांसप्लांट करने हैं सेल्स तो उसकी जितना नंबर चाहिए, अगर 2 किडनीज के लिए है तो उसका डबल नंबर चाहिए. अगर हेयर में स्टेम सेल्स आपने स्कैल्प पे लगाने हैं तो अगर एक छोटा पैच है तो उसके लिए अगर 10,000 सेल्स चाहिए, तो बड़ा पैच है तो उसके लिए उसके अकॉर्डिंगली आपको ज़्यादा नंबर चाहिए. Then stem cell therapy will work. So it will depend on the patient condition. Condition है, disease कौन सी है, acute है और chronic है, age of the patient, weight of the patient, and also the cell type or fraction that is used for specifically for stem cell based therapy. Now, effective processing, isolation. अब आपने सारा सेलेक्ट कर लिया, पेशेंट भी इनरोल हो गया था, हमने स्टेम सेल की फ्रैक्शन भी, स्टेम सेल का सोर्स भी सिलेक्ट कर लिया. नो द इम्पॉर्टेंट स्टेप इज़ द प्रोसेसिंग, एंड इन प्रोसेसिंग क्वालिफाइड स्टेम सेल एक्सपर्ट, स्टेम सेल प्रोसेसिंग फैसिलिटी, GMP compliant reagents and standardized laboratory procedure all are very important. और ये सारी चीज़ें जो है वो इंश्योर करेंगी कि स्टेम सेल जो रिक्वायर्ड, जो स्टेम सेल टाइप थी, स्टेम सेल नंबर था, वो क्या हमें मिल रहा है. तो अगर वो वाला नंबर मिल रहा है तो फिर स्टेम सेल थेरेपी के रिजल्ट्स जो हैं वो बेहतर होंगे. फॉर एग्जांपल ये मैंने एक एग्जांपल ले रहा हूँ. इट इज़ आई हैव टेकन दिस फ्रॉम दिस पेपर कि some labs isolate stem cells manually, while others also use some machine, some extractor. अगर जैसे ये पेपर शो कर रहा है तो अगर स्टेम सेल जो है हम मैनुअली आइसोलेट कर रहे हैं तो then there are about 250,000 स्टेम सेल्स पर ml, न्यूक्लिएटेड सेल्स पर ml of fat, और 5 times स्टेम सेल्स का नंबर कम हो जाएगा if we use the machines, the extractor of cells. So मैं जैसे एग्जांपल देता हूँ, आप SVF को प्रोसेस करते हैं, 3-4 आवर्स लगाते हैं, एट द एंड क्या होगा, हमारे पास ट्यूब है, उसके साथ सुपरनेटेंट है और एक पैलेट है. तो अगर इस लास्ट स्टेप में अगर एक्सपर्ट जो है वो सिर्फ उस वॉल्यूम को, उस लिक्विड को डिस्कार्ड अच्छी तरह से ना करे तो वी कैन लूज थाउजेंड्स ऑफ मिलियंस ऑफ सेल्स सिर्फ इस एक स्टेप में. और सिमिलरली अगर वॉशिंग हम एडिपोज टिश्यू की अच्छी तरह से नहीं कर सकते तो उसमें मिलियंस ऑफ जो सेल्स हैं विच आर नॉट रिक्वायर्ड, सिर्फ रेड ब्लड सेल ऐड हो जाएंगे और आपको इतनी बड़ी पैलेट मिलेगी, बट इट इज़ नॉट इफेक्टिव. So processing and isolation of stem cells is important to obtain required type of stem cells, required stem cell number, to avoid contamination and to maintain the viability. No, interestingly, the aged patients are the main target population for stem cell based therapies. However, the regenerative potential of stem cells is severely compromised with advanced age and with health status of the donor. And you know, autologous stem cell therapy is preferred, but it will be compromised in aged patients. अब aged patients आते हैं, अगर वही जो बच्चे हैं उनके लिए भी वही स्टेम सेल्स, उतना ही नंबर का स्टेम सेल्स करें तो एज जो पेशेंट है उनके अंदर इतनी इफेक्टिव नहीं होगी. Then we have to use other strategies. The reason is that the donor age, ये next कीजिएगा. the donor age negatively impact the regenerative potential of stem cells. ये next कर दें, वहाँ से next कर दें, next कर दें. So in such conditions, if the patient is aged, old, then you can increase the number of stem cells. आप ज़्यादा adipose tissue लेके process कर लें. You can expand the stem cells to increase the number of stem cells, or you can use different strategies to enhance their regenerative potential. Thank you. So for example, the donor age, due to donor diseases, donor age, adult stem cells have compromised function, and their proliferative migration, paracrine activity, and differentiation will be reduced, while senescence and apoptosis will increase. So these cells are less suitable for stem cell therapy. So in such cases, you can use different strategies, like you can use hypoxia, heat shock, caloric restriction, growth factors, and cytokines that will enhance their stem cell function. ये वाली जो इनकी characteristics हैं, उनको enhance कर देंगे. So these cells will be more suitable for stem cell based therapy. Next week. So two other factors, route of administration, delivery किस तरह से करनी है. So it will again depend on organs, कौन से organ effective कौन से हैं. अगर liver के लिए कर रहे हैं तो maybe it is IV जो है वो बेहतर है. Heart के लिए कर रहे हैं तो intracardial will be better. Next करते हैं. Next. कुछ आप टाइम कह रही थी, खत्म हो गया. बस ये 2 slides. Next video. So another, the recipient age and health condition is also important. Usually the stem cell therapy is more effective in young and healthy patients. Next video. And last, the number of sessions. Sometimes one session of stem cell may be not effective. So in such condition, we need more number of sessions, and it will depend the type of the treatment, disease condition being treated, and the stage of the disease. So normally the number of sessions of stem cell therapy are positively correlated with the outcomes of stem cell therapy. Next video. So in conclusion, stem cell based therapies are very promising. However, the success rate of stem cell therapy can vary depending on the type of treatment, the disease or condition being treated, and the stage of the disease. Thank you.